is Dr. Chris Ritchlin. Chris received his bachelor's degree at the University of Rochester, his MD at Albany. He got a master's in public health at Rochester. He was an intern at Albany, resident in Mount Sinai. He was a rheumatology fellow at NYU. Then he was a research fellow in Montreal. He's director of the Rheumatology Fellowship Program at the University of Rochester. He's director of the Clinical Immunology Research Center at the University of Rochester, and he's professor of medicine. He's been a member of the Committee on Education of the American College of Rheumatology and the chairman of the Professional Meetings Committee. He's a member of the steering committee of the Spartan. He's a member of the board of directors of the National Psoriasis Foundation. He's done extensive research into psoriatic arthritis and ankylosing spondylitis with multiple publications, presentations, and reviews. And this morning, this is actually a back tattoo on the back, but beyond back pain, old and new treatments for spondyloarthritis. Dr. Ritchlin.
It's a pleasure to be here. I have to tell you, being from Rochester, New York, I'm very comfortable with the weather. No problems. This is perfect. I was really worried about the sun when I got here, but that's not going to be an issue today. I'm going to talk. I'm a translationalist, meaning that I work with animals, models, and with humans to try and understand the mechanisms that lead to spondyloarthritis, and we also try and develop new treatment strategies. And so today, what I'd like to do before talking is tell you my disclosures shown here, and to basically first start with the basic phenotypes of psoriatic arthritis, spondyloarthritis, and talk about how they differ from rheumatoid arthritis. You'll be hearing later about psoriatic arthritis from Evan Siegel. To discuss immunologic and non-immunologic paradigms for HLA-B27 and new genetic loci, to discuss the role of IL-17 in disease pathogenesis, and then to focus this knowledge on the treatment strategies that we can use in spondylitis related to ankylosing spondylitis, reactive arthritis, and just briefly psoriatic arthritis, axial disease, because again, Evan will be talking about psoriatic arthritis later today. The bulk of my talk, though, is really centered around ankylosing spondylitis. So you've all seen this slide, and this really discusses the spectrum of diseases that are related to HLA-B27 and have some common phenotypes that we're all aware of. And we know that these clinical features that are seen in these disorders include an association with class 1 MHC alleles, axial involvement, a focus on osteitis and enthesitis, and not so much on synovial inflammation, the fact that peripheral arthritis, when present, is usually asymmetric, and that there are a variety of differing extra-articular